Hello and welcome to your first aid session. So today we're going to be talking through and demonstrating Paediatric CPR. In order to provide the right treatment for a child or an infant, we need to know how to define them. In first aid, we define an infant as 0 to 1 year or small enough to perform CPR with 2 fingers. Whereas we define a child as 1 year to puberty, so approximately 12 to 13 years of age, or small enough to perform CPR with 1 hand. So before I demonstrate the CPR, just a quick reminder of the new UK Resus Council guidelines that during the current climate, due to the heightened risk of the coronavirus, they advise not to perform mouth-to-mouth ventilations during CPR on an unknown patient. We should just perform chest compressions. So going back to our child CPR, once we've found out they are not breathing and we've called for help, we then come back to the patient. We need to perform 5 rescue breaths, providing they are not an unknown patient. We tip the head back as far as we can, squeeze the nose, and do 5 1-second blasts of air. If there's no change, we then go on to our chest compressions. Head of the hand is placed in the centre of the chest. We need to be over the patient with our elbows locked. Remember, we're using 1 hand because it's a child, so we can support the arm. And we perform 30 compressions at the rate of 2 a second. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 27, 28, 29, 30. Then we go back to 2 rescue breaths. Open the airway, squeeze the nose, 2 blasts. And then continue back onto our 30 compressions. So we're doing 30 compressions, 2 breaths, 30 compressions, 2 breaths, continually until further help arrives. In the next video, we'll look through infant CPR. Thank you for joining us.